Hello and welcome to our special COVID-19 update program here on Channels Television. I am Ladi Akeredoluale. Here are the highlights for tonight. Federal government wants citizens to continue to obey COVID-19 containment protocols during the coming Ramadan period. Foreign Minister says only 400 Nigerians can currently be accommodated in the protocol of returning to the country. And South Africa is to deploy more than 70,000 extra army troops to ensure lockdown to contain COVID-19 spread. We begin in Abuja, where the chairman of the Presidential Task Force on COVID-19, Boss Mustafa, has been speaking on the present situation in Kano State and how the task force is collaborating with the state government to contain the spread of the pandemic. Speaking during today's task force briefing in Abuja, Mr. Mustafa added that the fasting period for Muslims is fast approaching and they should not indulge in acts of congregational prayer.
The situation in Kano continues to be of concern, and the Presidential Task Force is working in close contact with the state government to arrest the situation. The Presidential Task Force will update you as soon as there are new developments. Ladies and gentlemen, let me remind us all that this pandemic is real and is spreading like wildfire. We must all arise to fight this potent and invisible common enemy by adhering to the guidelines and protocols for COVID-19, which includes personal hygiene, social distancing, wear of masks in public places, obeying the stay-at-home order, and reporting unusual illness to the authorities for investigation. It is anticipated that by Friday, 24th of April, by the grace of God, the Ramadan season shall commence. The statement has directed the Ummah on the suspension of obligatory religious activities such as Jumat, congregational, and other sessions during the month of Ramadan to prevent the spread of COVID-19. It similarly encouraged scholars and organizations to use all other means of communication and brokers to disseminate information and conduct programs. Our prayer is that the Almighty shall accept our collective supplication and show mercy.
Chairman of the Presidential Task Force on COVID-19, Boss Mustafa. For some Nigerians abroad who are hoping to be airlifted back home in time, the Foreign Affairs Minister, Geoffrey Onyema, explains that Nigeria presently does not have the capacity to accommodate all returnees. Mr. Onyema, however, says that government will periodically review the process and with availability of more facilities, be able to accommodate more people.
We took medical advice. I mean, we asked the medical people what was possible. And the figure we were given was 200 for Lagos and 200 for Abuja. Of course, this is, much less than the numbers that are waiting to come back. But we're just constrained by the facilities that are available. And, and unfortunately, I mean, because we have the challenges, internal challenges, as you can see, the figures are going up, all the time. And so, we have a great responsibility to also ensure that these facilities are also there to deal with the immediate challenges we're facing back home. But, if the opportunity presents itself and we find that, more facilities become available, then of course we would, look at the possibility of expanding and increasing the numbers of people that we can bring back. But the fact of the matter is that at this moment, this is a framework in which we've been told that we can operate.
Foreign Affairs Minister Geoffrey Onyema. Now, our correspondent in Abuja is Kayla Megwa, and she joins us from our Abuja studios. Good evening, Kayla.
Good evening, Ladi.
Let's begin with non-compliance, which has been more or less the story once you're not talking about Abuja city center. This time, you're reporting from Kubwa, right?
Yes, I am, and the visuals that you're about to see are pretty disturbing. This is early in the morning. The person who took that video is one of our cameramen. His name is Mr. Gbenga, and Gbenga actually took that video on his way to our 8 a.m. meeting in the office. So this is before any 10 a.m. when you're supposed to go to the market on 2 times during the week. This wasn't a day that people were supposed to be in the market anyway. That was a regular morning. And he just came out, and that was the holdup at the Kubwa Expressway. And that is not just in Kubwa. We're seeing that all over the city center. We're seeing that right now in the middle. Yes, I said city center, not just the suburbs anymore. We're seeing that in the city center this time. We saw it today in Garki. We saw it as well in Lugbe, at AYA. And then we also saw it in Wuse as well. In fact, the security agents right now have their hands full. Today, especially, it was almost business as usual. I started wondering if the lockdown had been lifted because many people, for some reason, have decided not to listen to the sit-at-home order anymore. Now, they're not even adhering to the 10 a.m. to 2 p.m. on particular days when you can go to the market. No, people are just running around and doing their own business. At the Kubwa Expressway, what they do is when, because the police have blocked the road, they try to find out who you are, where you're going to, you know, what urgent business matter you have to attend to. And they stand at places that have turns. So if you can see from the visuals there, there's a place that has like a turn back to Kubwa. So if they find that you're not qualified to be on route at that time, they turn you back. But the sheer number of people who are on the roads when there's supposed to be a sit-at-home order, especially with what we've been hearing recently about community spread of COVID-19. We're seeing this disease in communities, and it's people from these communities that are still moving around like this. It got a little better not too long ago, but it's suddenly gone really bad, Laddie.
That's on one side. The other point you raised yesterday had to do with insecurity in the suburbs. What's the situation now? Has that improved?
From what we're hearing from Kubwa, especially, because that was the first place where they sent us a report of an armed robbery that happened in broad daylight at Kubwa Phase 3. Now, the people in Phase 3 are saying that, yes, they can see more security operatives, you know, in their neighborhood, so they feel a little safer. But one thing that's been happening in places like Suleja and Lugbe is that the people who live in those areas have formed vigilante groups themselves to protect themselves from these people who are trying to rob at a time when people are staying at home. So the call is, of course, the security operatives are doing what they can, especially in Lugbe. They added additional security men in Lugbe, you know, to help, to join with the citizens who have formed vigilantes to protect themselves. But, you know, more needs to be done to protect people. And it's just a very disappointing situation, Laddie, where people are trying to grapple with the fact that they can't make any money right now. They're in a sit-at-home order. There's literally almost everyone is asking for money from everybody at this point in time, and we're trying to keep it together. But at this time, some miscreants are using the opportunity to rob people. And this is happening in Suleja, Lugbe, and like I told you earlier, in Kubwa Phase 3. At least those are the places where we've gotten a report. Yes, we also got a report from Maraba yesterday about robbery incidents happening in those areas. So yes, that's been going on. And they're asking for more help from security agents in the nation's capital.
Finally and briefly, the UNHCR, on a positive note, is bringing some relief to the IDPs. What can you tell us about that?
Yes, and it's one of many efforts. The UNHCR today delivered wash items. So we're talking hand sanitizers, soaps, face masks, and buckets. So they made all these presentations to the Refugee Commission here in the nation's capital. It was a 10-minute event. They just basically brought it out. The UNHCR woman was asking the government to include internally displaced persons and refugees in their action plan, in whatever response they're doing, the government is doing to this disease. They're asking that IDPs and refugees and migrants be a part of the process. Well, the materials that were distributed today are going to be distributed to some states in the nation. And, this is the first of 2 phases. Right, so this is the first phase of provisions that they're making available. They're going to make another set of wash items available for people who live in IDP camps in places like Cross River, in Benue, in Borno. So those are the people that are going to be beneficiaries of these items that they've made available. And they say they're going to keep doing this over and over again. And that's just one out of many people who are trying to do what they can to supply as many of the required items for this period. So yes, the UNHCR did that today in the nation's capital.
Thank you very much, Kayla. Do keep safe out there as you go about this essential service. Thank you very much for that update. Our correspondent, Kayla Maguire from our studios in Abuja. And we go to the Northeast while waiting for the formal announcement by the Nigeria Center for Disease Control, the NCDC. The governor of Adamawa State, Amadu Fintiri, has confirmed the first COVID-19 positive case in that state. Governor Fintiri joins us now via Skype to give us details of this very latest development. Good evening, Your Excellency, from Adamawa State. You're talking from Yola, its capital. How did the information of this first case get to you?
It came to me as a surprise. It was shocking because it's what we were not expecting in the state. We've been very precautionary in most of the measures we have taken. But lately, this morning at 1:30, I got an email from the COVID committee of the state informing me of a journalist who had been away from the state for 6 months, but suddenly came in to town on the 16th of this month. And he presented himself at the State Specialist Hospital for COVID-related ailment, and then he was tested, and the result came in yesterday as positive. And we made arrangement, and we moved him to the isolation center where treatment has already commenced on him this morning.
Now, who conducted this test that brought him back positive?
You said?
Who conducted the test? Where was this test conducted, and who certified the results?
Yesterday, NCDC in Abuja.
Moving on from there, the isolation centers that you made reference to, or the isolation center you made reference to, now that Adamawa has an index case, those isolation centers will become important. What preparations are you putting in place, or what preparations have been put in place for this pandemic now that it has gotten into Adamawa State?
Long before now, we have put a lot of preparations on ground. We are adequately prepared. We know it will surely come. We didn't pray for it to be here. But now that it is here, I think the professionals, particularly the health workers, are ready to do their job and to ensure that they serve the pandemic situation, particularly the COVID patient.
Are you planning to lock down?
Are
you planning to lock down Adamawa State?
Yeah, of course. It's the only option at the moment because we have to go ahead to start tracing the contact of the index case, and the only way we will make it easier and smoother so that we identify everybody that the gentleman had contact with is to lock down completely the state, and also prevent and lock our neighbors from coming in and our citizens from also going out. And then the traces will be easier, much better, and then we'll go ahead and even do testing. And whoever that is infected, we go ahead and treat him. That is how God wants it.
In terms of palliative measures, if you lock down the state, given the antecedents and experience of elsewhere, the issue will then arise as to how people who are now locked down, who earn their living daily, to survive. Are there measures put in place in that direction? Since you've confirmed that you intend to lock down the state, now you have this index case.
Since the outbreak of the pandemic, this is not the first time we are going to lock down the state. I think we have just unlocked the state in the last 8 days, and our people have a lot of experience on the lockdown. But the first, what government did as a major palliative is to pay their workers' salary. Today and tomorrow, they will start receiving their salaries. And for the rest of the citizens, we will make a lot of adequate effort to ensure that we deploy palliatives so that we can cushion the effect of the lockdown on our ordinary citizens. Government is mindful of that.
Ramadan is expected to begin tomorrow or at the very latest on Friday. The SGF was quoted today, we saw him on our television screens, asking that since Islamic authorities have made it clear that no congregational prayers are to be observed and all the other various things that come with Ramadan are to be avoided, to keep in line with the protocol. What do you make of that, and what are the plans to enforce that in Adamawa State?
We don't take directives from NCDC or the SGF. That would be a purely state decision to take that directives as to when we lock down the state, when adequate preparation must have been made. And I think we have more than enough preparation to take that decisions when it is necessary. But I can't say for now when we are going to lock down the state.
All right, then. Thank you very much for joining us at this time. The governor of Adamawa State, Adamu Daifintiri. Thank you so much for joining us via Skype from Yola. And we can go to the northwest now, where Governor Abdullahi Ganduje has been speaking about the issue of mysterious deaths and a number of other things with the COVID-19 pandemic in Kano State. Earlier this evening, he was on Politics Today, where he told the anchor, Seun Okinbaloye, that the COVID-19 vaccine, which was being alleged to be selling in Kano, was only on the social media, as authorities had not been able to locate it.
I want to assure you that the information as portrayed by Daily Trust some 2 days ago is that information is not correct, because we undertook a survey and investigation, and the initial report that I have received from one grave where some people reported 70 deaths, we found out there was only 13 deaths in that place, and we will soon get a complete report. But I assure you that information is not correct. Looking at previous burials, there is nothing to show that there is unusual frequency of death in Kano State. But there's a lot of fake news going around. It is true that the test laboratory has been closed down for today, and we understood that there is infection within the laboratory itself. Probably some of the technicians have proved positive, but I think the federal government is taking care of that urgently. Also, there is issue of scarcity of reagents and scarcity of the bottles that convey the samples. That one too, we discussed with the DG, and they assured us that they are taking an immediate action. But Ramadan is coming, and the lockdown was initially for 1 week, which is expiring tomorrow. So tomorrow we declared from 6 a.m. to 12 midnight tomorrow, we allowed it to be a free day so that people will get ready for preparation of the fasting period. But by 12 midnight on Thursday, then the lockdown will continue until another 7 days.
Kano State Governor Abdullahi Ganduje updating us on developments on various fronts at COVID-19 in his state. And coming up after the break, I'll be joined in our studios by consultant public health physician, Dr. Esther Oluwole, to discuss the very latest in these developments in Kano and indeed other places. Please stay with us. Thanks for staying tuned. Welcome back. As I said before the break, joining me in our Lagos studios is a consultant public health physician, Dr. Esther Oluwole. Thank you so much for coming in at this time.
Thank you for having me.
Let me begin by talking about the situation in Kano. Barely 10, 11 days ago, Kano had only one case.
Just one case, yes.
And today, we're talking about
60-something
cases. Is this normal, what had been warned about when we talk about the speed of spread?
Well, I won't say it's not expected. But if by the time we're having a lockdown in Lagos, in Ogun, and FCT, Abuja, if everybody has done the same thing, most likely taking every necessary precautions, social distancing, hand hygiene, use of face mask and everything, maybe Kano will not have had it like this. But because they were relaxed, so the cases kept on increasing and increasing up to this moment.
Now, that brings us to the main reason why we talked about lockdown and some of these other measures, managing community transmission, which is where there's the fear that things could really get out of hand.
Yes.
How do we do that now if, as you say, the lack of coordination or the absence of coordination amongst the various geographical jurisdictions means that as people are locking down here, others are relaxed? And
Exactly.
so how do we go about this? How do we do this?
Now, post-lockdown, because even the lockdown is not that effective anymore, people are on the road looking for what to eat. And I can't blame them. People are hungry. They want to eat. They need to find something to do. They want to go out. Now, post-lockdown, there need to be new strategies because you can't continue, you can't lock people in forever. So government need to come out again with new strategies. Okay, in like the Lagos State is saying now that from next week, whether the lockdown is off or not, everybody, when you are going to public places, must put on face mask. So that must be made compulsory for everybody in every state. Then the social distancing should continue. We will have to continue to create awareness. Awareness cannot be enough. It cannot be more. It cannot be much. We need to continue to create awareness. Up till now, some people don't still believe that COVID-19 exists. They don't believe there's anything called COVID-19. They believe that government just wants to suffer them. We need to still create more awareness, and this is now the time actually to do community involvement. We have to involve community, the leaders in the community, the church leaders, the market leaders, the women leader, the youth leaders, and everybody. People hear, people listen to these people in their communities. So when you involve them, when you engage them, when you train them and they go back to their community, people listen to them. So we need to now put up some strategies in public places. Water, running water, that people can wash their hands. And then put on the sanitizer to rub your hand before you enter to do your shopping. And there should be a way that you can control the people coming in and coming out. And also in the market, there could be some strategic locations that these things will be, so that then the buses, the vehicles, government needs to come up with what's the different policies, because this is now community transmission. You don't know who is the next person to you. It's better now to take every next person to you as being positive. Even until you yourself get tested, you are not sure whether you are positive. So you don't know when. So we should take everybody now next to you as being positive until you get tested and you are. So there needs to be strategies to curtail the pandemic as people begin to move out. We should just continue the face mask, washing our hands, then use of hand sanitizer where you cannot have access immediately to water and soap to wash your hand. Physical distancing and social distancing cannot be left out. Then we need to educate, we need to involve the community leaders. Then we need to continue education in the community. We need to let people know that this virus exists, and so that they can take precautions, so that they don't see it as, oh, government wants to punish us.
Now, if we take a look at it now, the part of the reason for the lockdown was for people to be caught at home so that they could do some of the things you've just mentioned.
Yes.
That is the issue of testing them,
Yes.
and then looking for contacts of
Yes.
cases already confirmed positive,
Yes.
who may have been moving around, but with the lockdown, they will be in one place.
Yes.
If we are examining a post-lockdown
Lockdown.
era, how do we go about those kinds of people? Because as we have more and more cases, almost 800 of them now,
Yes. Still have to do contact tracing.
they're still doing contact tracing
Yes.
as each new case comes
Yes.
up. How do we do that if, the lockdown is no longer in place?
Well, contact tracing needs to continue. It cannot be stopped. Anyhow, people will still move around, but we need to find a means of locating them, especially when you know this person has had contacts, is on your list, that is a contact. We need to look for that. Contact tracing cannot be stopped. It has to continue. We have to find them. We have to test them, so that if they test positive, you can isolate them. We can't just fold our arms and say, okay, post-lockdown, everybody should just go. No, all those preventions should still continue. So contact tracing, house-to-house contact tracing, still continues.
But if these people are not at home, if things return to, maybe I shouldn't use the word business as usual, but
Yes.
if things return to fairly normal,
Yes.
they'll go to work,
Yes.
they'll go to school,
Yes.
others will go
Or they
back.
have phone number. Thank God for social media. We can reach them on phone, can text them, can get to their house and drop something for them that, please, your attention is needed somewhere, and can call them. So we still have to reach them.
Are you optimistic going forward that we will be able to get a hand on this pandemic, even if some of the things that have kept people in a bind, so to speak, are removed? Are you optimistic that we will be able to get a hand on it? You've spoken about strategies in various strategies and so on. Will we
Yes.
put them in place in good enough time before this becomes a real problem?
Yes. Yes, I'm optimistic that we'll be able to curtail it. Like I said, we'll still continue to create awareness. We still continue to educate our people. We still continue to engage the leaders, the community leaders. And then the awareness can have to continue. I'm optimistic that we will curtail it. Because you can't lock people down forever. We have to keep on telling people about the social distancing, personal distancing, use of PPE, use of your face mask while you are going out. And then, like I said, the contact tracing must continue.
Dr. Esther Oluwale, it's been our pleasure having you with us on the program. Thank you so much for coming in.
Thank you for having me.
We go to the southeast, where in Imo State, our correspondent Tokwe Kuteye reports from its capital, Owerri, on the curfew.
It's the 5th day of the dusk to dawn curfew imposed in all parts of the state by the Imo State government. This is in addition to the earlier lockdown directives given by the state government to prevent the outbreak of the coronavirus disease in Imo State. The government is restricting movement between the hours of 6 p.m. and 6 a.m. daily. Even though the streets are still empty, but we were able to get some Imo indigents who are on essential services to speak to us on their thoughts on the curfew order by the state government.
It's a welcome development because for you to stay safe, since scientifically for now there is no approved cure yet for this COVID-19, but government should also think about other palliative measures so that the citizens will not be killed with hunger.
The challenge is that people don't have free movement.
getting what they eat and all. Transportation is somehow. A lot of people are walking about the road and all those stuff. Imo State is yet to record any case of the coronavirus disease, but the state government, through the COVID-19 committee headed by Professor Maurice Iwu, said they are scaling up activities to prevent the outbreak of the coronavirus disease in Imo State.
Our strategic approach is that we want to make sure that we get every information that we know internationally, nationally, and then translate the same, domesticate it to our state so that we'll be able to have the maximum impact of whatever modern technology is saying to our people.
We'll continue to keep you up to speed with events and happenings around there as it unfolds. From Owerri, the Imo State capital, Eyitope Kuteyi.
Eyitope Kuteyi reporting earlier on today. A lot of discussions around the world have been centered on the production of a vaccine for COVID-19. A few countries are in fact looking at candidate vaccines. To look at the potentials, I have joining me from our Abuja studio a virologist and member of the West African Network for Tuberculosis, AIDS and Malaria, Dr. Akiala Ishaku. Good evening, Dr. Ishaku. Thank you for your time.
Good evening, Ladi. Thank you, viewers.
Now, the potentials for COVID-19 vaccine. Yesterday, we reported that in the United Kingdom, clinical trials are going to begin on some potential vaccine tomorrow. And there have been other countries that say they're also looking at it. What do you make of these efforts so far?
Actually, it is a great effort in coping this pandemic. And I want to commend the countries of the world for translating knowledge into products, because that is what the 21st century is all about. It's about harnessing knowledge to make it to products that can be able to service humanity. And so as it is today, there are about 40 companies in the world and academic institutions that are into the production of COVID-19 vaccines, candidate vaccines. And the United Kingdom Health Secretary spoke yesterday that they will commence clinical trial tomorrow in the United Kingdom. I think it's a welcome development. In 66 days to come, there will also be clinical trials in the United States of America using the candidate vaccine. We call it the RNA candidate vaccine. So I think much progress has been done in that regards. So I want to commend for them for that speedy. It shows that in the 21st century, it is all about a knowledge-based economy. So you translate knowledge into product. And I think this is what we also need to look inward as a country, to be able to harness our knowledge and be able to go into translational research. So a lot of, in the coming days to come, in the coming weeks to come, a lot of countries will go into clinical trials and then be able to see if this candidate vaccine are going to be successful. Mind you, the two objectives of clinical trials of vaccine is to look at how safe they are and how effective they are.
You talk about looking inwards, which brings the next question having to do with what are our own scientists, our own virologists, and other such scientists in our own situation here, in our own ecosystem here, making? What are the contributions that you see them making? Do we, for example, have any vision or any actual effort towards either making contributions to a vaccine production or working on our own at this point in time, since we also have the COVID-19 pandemic in Nigeria?
Yeah, Ladi, let me take you to memory lane. Let me take you to memory lane. In the early 70s, Pawosu was granted a WHO partial accreditation for the production of human vaccines at the Human Reference Lab in Yaba, Lagos. So in the early 70s, Nigeria was supplying vaccine to the whole of West Africa. So we have that capacity at that moment. And then the National Veterinary Research Institute in VOM in Jos Plateau State was established to produce animal vaccines. And so over time, we lost it. But coming to bear, that brings about the national question. Do we have necessary framework for us to harness human resources to combat this pandemic? As I speak to you up till now, I've not heard of any constitution of any technical working committee. So I expect that apart from the presidential task force, we should have a national technical working committee where we can bring virologists together, where we can bring vaccinologists together, where we can bring public health experts together, where it is a multidisciplinary approach to this. And then we begin to assemble teams, and then we begin to push forward. Ladi, I want to tell you that Nigeria has all it takes to be able to go into this. And so we have the human resources, we have the capacity in terms of human resources to go into vaccine designs and then be able to set up, even to have a protocol to await for clinical trials in the nearest future. So I want to commend the federal government for the push for this fight and the NCDC, but I still want to call on them to look at setting up a national technical working committee where we can draw expertise from the academia and then draw expertise from the biotech industry and then begin to come up with future plans for the production of vaccines. Ladi, I want to tell you that I've been in Europe for quite some time. A lot of Nigerians are working in big biotech companies all over Europe. I know a lot of them in Sanofi. The one heading the vaccine development in Pfizer and GSK, they are all Nigerians. And I think we can have a window also to do welcome back home and to begin to tap into their expertise. I follow Abike Dabiri chats on webinar and on Zoom on diaspora, how they can be able to contribute back. I had a classical vaccinologist from the United States of America providing solution for us to have our indigenous candidate vaccine. But what we need to do is to set up a technical working committee for combating this COVID-19 pandemic. And then we need to also move into that to begin to start to generate data.
We've completely run out of time. I'm sorry I have to cut in at this point. Thank you very much. This discussion has been very interesting. Thank you very much, Dr. Ishaku, for making yourself available today from our Abuja studios. Yesterday, the highest confirmed cases of COVID-19 in Nigeria were announced by the Nigeria Center for Disease Control, the NCDC, and that stands at 117. Sadly, 25 fatalities have now been recorded, but the good news is that the number of COVID-19 discharged patients is up to 197. That leaves the number of active cases being managed across 24 states and the Federal Capital Territory at 560. So far, the total confirmed cases stand at 782. Interestingly, the demographics of the cases show that 544 are males, that's 70%, while 30% are females, accounting for 238 cases. We'll take a break at this point, and when we return, we'll find out how COVID-19 is faring in other parts of the world. For staying tuned. The Director General of the World Health Organization, Dr. Tedros Ghebreyesus, says he believes the group warned the world of COVID-19 early enough. He further explained that the WHO issued its warning when there was no death and just 82 cases. While several governments have praised the WHO, saying its work at this time is vital, the Director General has come under heavy criticism over his handling of the crisis, principally from the United States. Meanwhile, more than 2.5 million people have contracted the disease across the world.
More than 2.5 million people around the world have been diagnosed with the coronavirus. More than 170,000 have died. with the US accounting for about a quarter of all deaths. Africa is still recording low figures compared to the rest of the world, with more than 24,700 cases and 1,193 deaths.
Right, the global update. But in Africa, more than 70,000 extra troops will be deployed in South Africa to help enforce a lockdown intended to stop the spread of coronavirus. That's according to the President, Cyril Ramaphosa. South Africa has had 3,465 confirmed cases, second only to Egypt in Africa, and 58 deaths. I'm now being joined by Channels TV's South Africa Bureau Chief Betty Dibia. Good evening, Betty. What more can you tell us? Why is there this dramatic increase in the number of troops for enforcement?
Well, before I go there, just a quick update on the numbers from South Africa. We have an additional 170 new cases. So that brings the number to 3,635. Unfortunately, 7 more deaths. Now we have 65 deaths recorded in the country. But going back to the troop deployment, the president had written to Parliament informing the body that he intends to have employ additional members of the National Defence Force across the country for various reasons between April the 2nd and June the 26th. So the Joint Standing Committee in Parliament had been talking about it. The Defence Minister as well briefed Parliament on that. And he says that it is to help or to support the various departments. And that is supported by the statement released by the Defence Forces, National Defence Force this evening, saying that it's for troop deployment. The bulk of that coming from the Army. You have the military health, the Navy and the Air Force and the reservists as well. So these are supposed to support the department with their various skills in engineering, logistics, and health. And the Army, the Defense Force says that it's part of the total government scenario planning in case this goes beyond. But some people are the members of Parliament, especially those in opposition, are wanting to know in detail. They expect to know in detail what the president actually wants these people to do. Having 70, this is compared to what we had before, 2,280. Now they're expecting 73,180. So they want to know in detail what exactly these people will be doing, although they stand by the forces or the members of the Defense Force. So far, despite all the issues that have been raised by some people, some have commended and some are condemning their conduct with the people, talking about high-handedness. And of course, we recorded the issue of the death of a young man in Alexandria last week, with allegedly at the hands of members of the Defense Force. So that is what we expect the president to speak tomorrow, to give us details of what he wants to do, if, when, and how the lockdown will be phased out, or what he plans to do, and also all the things he announced to the nation yesterday. We expect the different ministerial clusters to talk to us on Friday as well, to give more details how these things will be worked out.
All right, then. Thank you very much, Betty. South Africa Bureau Chief Betty Dibia reporting there from Johannesburg in South Africa. Thank you very much, Betty.
Thank you.
And that's how we wrap up our COVID-19 special this evening. Thanks for being with us. My name is Ladia Karidelwale. We're back tomorrow with an update at noon, 6, and then at 9. Good night.